So the Ministry of Health would like to inform the public of the confirmation of Ebola virus disease in Kasese district, Uganda. The confirmed case is a 5-year-old boy who traveled from the Democratic Republic of Congo with his mother yesterday, the 10th of June 2019. The mother is of Congolese origin but married to a Ugandan, and they reside in Kasese district. However, she had traveled back to the DRC to nurse her father who succumbed to Ebola. The mother and the child were accompanied to Uganda by 4 other family members who are all of Congolese origin, including the wife of the deceased. The child and his family entered the country through Bwera border post and sought medical care at Kagando Hospital, as the child was not feeling well by the time they came into Uganda. The child presented with the following symptoms: vomiting blood, bloody diarrhea, muscle pain, headache, fatigue, and abdominal pain. The same night the family entered Uganda, the teams from the DRC alerted us of the presence of contacts of a deceased Ebola case who had crossed into Uganda and provided their names and telephone contacts. They expressed their worry and requested for a cross-border meeting for us to further address the frequent crossing over of contacts into Uganda. Upon receiving this information, all our health facilities were quickly informed to be on alert, and information of these contacts were provided to the health workers. The child was detected by the health workers at Kagando Hospital with signs and symptoms of Ebola and immediately transferred and isolated at Bwera Hospital Ebola Treatment Unit for further management. A blood sample was drawn and sent for testing at Uganda Virus Research Institute very early on the morning of June 11th, and the sample tested positive for Ebola. All the other Congolese family members have been identified and are in isolation at Bwera Hospital. 2 of them had their samples removed when they developed symptoms similar to that of Ebola, and the samples are on their way to UVRI. Results will be communicated tomorrow. 8 contacts have been line listed and are being followed up. The Ministry of Health, the World Organization, and the Center for Disease Control have dispatched a rapid response team to Kasese to support the teams who are on the ground to continue with the various activities, including contact tracing and case management. The Ministry of Health, WHO, and CDC will undertake ring vaccination of contacts to the case and other non-vaccinated frontline health workers, as well as other workers beginning 14th June 2019. In conclusion, Uganda's preparedness has been converted into a response mode. The Ministry of Health re-echoes its call on the general public to cooperate with the immigration, health, and security officials to ensure effective screening at all entry points to prevent further spread of Ebola to other parts of the country. The ministry would like to assure the public that the vaccine that will be given is very safe and effective, and contacts of frontline workers and other workers identified for vaccination should willingly take the vaccine for their own and family protection. The ministry would like to reassure all Ugandans and all other residents in Uganda that with the experience and expertise available in the country and the over 10 months of preparedness, the disease will be contained. We appeal to the public to remain calm and vigilant and report any suspected cases to the nearest health facility or call our toll-free number 0800 203 033 for God and my country. We leave at 5 a.m. 5 a.m.
So what do we meet?
We